This presentation is in your Introduction to Forensic Nursing N375, and I am Brenda Johnston. The objectives for this presentation are to define forensic nursing. We're going to summarize the history of forensic nursing and talk about members of our multidisciplinary team. We're going to also talk about goals and benefits of a forensic nursing program. Forensic nursing was first defined by Virginia Lynch in 1991 as the application of forensic aspects of health care. Virginia Lynch was working as a nurse coroner when she was inspired to define forensic nursing in her master's thesis. The first forensic nursing programs were started as sexual assault nurse examiner programs back in the late 1970s. It wasn't until the 1990s that the International Association of Forensic Nursing was founded. We now have multiple state chapters across the country with programs nationwide essentially, and actually internationally as well. We have standards of practice. Unfortunately, we have a lot of different names, be it a sexual assault nurse examiner, a sexual assault forensic examiners, forensic nurse examiners, but all in all, we're about the same. We collect biomedical and trace evidence and work with victims of violent crime, not just victims, but also suspects. Forensic nursing is a field of nursing that requires extensive training in the medical legal evaluation of crime victims. Education involves physical examination of persons who are suspected victims and also suspects. We do photography, evidence collection, and preservation of evidence, and work with really the legal system, testifying for both prosecution, of course, as well as a defense, so it doesn't matter what side we're on. We are testifying to the facts and providing opinions, and when we provide opinions, we are considered expert witnesses. And in order to be an expert witness, you have to have the experience and background to qualify. We qualify as expert witnesses actually when we're in the courts and they review our background and qualifications, and the judge actually makes that determination. So our qualifications can contribute to earning certifications. Training for sexual assault nurse examiners is about 40 hours didactic. You do not have to be a master's or doctoral prepared nurse. You can be an associate degree nurse to attend trainings and work as a sexual assault nurse examiner or forensic nurse examiner. We do have advanced practice levels, and you can obtain a certification through the American Nurses Credentialing Center, and that's it's ANCC. And that is basically our portfolio evaluation. You can also obtain certification through the International Association of Forensic Nursing, and that certification, though, is for a sexual assault nurse examiner, either for adults and or pediatrics. Practicing within the field of forensic nursing, we draw our knowledge from the nursing sciences, forensic sciences, as well as from criminal justice. There are multiple roles for forensic nursing, and that includes working in the correctional institutions, working in nursing homes with geriatric populations, legal nurse consultants working for primarily attorneys, nurse educators, sexual assault nurse examiners, of course, death investigation. And remember, whenever you're working in a medical setting, you're going to be working with forensic patients. Always remember, whether you know it or not, seriously, we are all forensic nurses. This is Virginia Lynch's original theory development, complete with pictures, and you can see all of the overlap of the various professions and where we draw our expertise. We have Joint Commission requirements that require all hospital settings have a method or policies and procedures in place that define how evidence is going to be collected and how victims of crime are going to be treated within the clinical setting. Our program started at Winchester Medical Center because we realized that patients needed prompt attention when they first came into the hospital. It seemed that everything came to a bit of a screeching halt whenever a patient presented who had been a possible victim of sexual assault. Forensic nurses generally work with patients who are not just victims of crime, but offenders, as well as trauma victims from domestic violence or intimate partner violence. We sometimes become involved in working with suspicious deaths. Forensic nurses within clinical settings generally work with living victims of violent crime and rarely cross over into the purview of medical examiners. There are forensic nurses who practice as nurse coroners, but remember, they are not practicing within a clinical setting. It's important to know that the goals of a forensic nurse program is not just about getting the bad guy. It's about providing crisis intervention, evidence collection, providing treatment possibly for sexually transmitted infections, HIV, hepatitis C, preserving basic rights of patients, providing documentation that can be understood by laypersons and folks who work in the criminal justice system, providing public education, and of course providing expert witness testimony, which means, again, stating opinions about evidence collected. For instance, if someone has injuries that are consistent with having been hit in the head with a hammer, it's not saying, okay, this is consistent with having been hit in the head with a hammer. It is consistent with blunt force trauma, and that's just a simple example of an expert witness testimony. There are some forensic nursing practices that stand alone. Those types of practices frequently work alongside of shelters for abused women or law enforcement, where they collect just evidence and don't provide any types of treatment services. Our program, of course, was housed within a hospital setting. We had a separate cost center. We had a 24/7 service, which meant we were on call a lot. We had a very well-defined practice area, and we're called in basically as consultants at times. We were quite independent and maintained pretty high visibility within the hospital, although it was at times challenging for folks to remember that we existed. So we wanted to always try to keep our name in the hospital, and we provide education services to the staff quite frequently. We maintained our records within a separate area from the medical records department so that forensic files were not mixed in with medical records. We had to stay current in the research, especially since we were providing expert witness testimony. And we ran our program like a business and utilized funding from the state to help justify our existence and show that we were not a financial burden for the hospital. And of course, we maintained a very nice professional practice and worked very closely with folks in the community. When our program first started in 1998, there were a lot of obstacles. Of course, not many people knew about forensic nursing or forensic nursing program, so we had to justify the expenses, the time commitment. We had to recognize that at times we had a lot of professional restrictions, such as performing pelvic exams without supervision of physicians. Our pelvic exams were performed under the auspices of evidence collection, so they were considered non-diagnostic pelvic exam. The educational opportunities were challenging. Training for forensic nurses was expensive. It cost about $600 for the didactic training, and then there was an additional 60 hours working with law enforcement, the court systems, shelters for abused women. Lots of different clinical sites were involved. We were forging some new territory, and again, we were constantly having to justify our existence. And of course, maintaining our credibility, because we were nurses and mostly physicians were testifying as expert witnesses. So it was hard for folks to realize that as nurses, our opinions could be respected, trusted, and reliable. So again, we relied very heavily on the research that was out in the field, and made sure that we worked to increase research in the field as well. We work as part of a multidisciplinary team with law enforcement, emergency medical services, social services, not just the Commonwealth Attorney, but the district attorneys as well, or defense attorneys. We worked very closely with the Victim Witness Program, and they are located within either Commonwealth Attorney's Office here in Virginia, or with prosecuting attorneys or district attorneys in other areas. We worked closely with victim advocates, and the advocates we utilized primarily were advocates that were trained and provided to us by the Shelter for Abused Women. And our Shelter for Abused Women in Winchester is called the Laurel Center. We joined with them on a multitude of projects, helping them to develop their crisis intervention program, as well as their child response. And we were able to build a very good relationship with them, worked with them also on some awareness projects, and we helped provide forensic nursing training and increased awareness of our program for their staff as well. So we had a fun toolbox. We utilized physical evidence recovery kits. That's a perk, and that was provided to us by law enforcement. They had nice little packaged boxes of evidence, and we would use those. Those were not charged to the patient. Again, those were provided to us by law enforcement, and those were directly from the state. Alternative light sources, I never had much use for those. Toluidine blue dye was an excellent technique for helping us to identify the presence or absence of injuries. Examiner techniques included just positioning, just again being familiar with techniques that help to improve our ability to visualize, for instance, hymenal visualization techniques, and just positioning of children in order to have a good exam that wasn't too invasive. Forensic photography, as well as the art of documenting forensic findings, and then of course interpreting those the injuries or evidence collected. And then I got to tell you, the best tool in that toolbox is a really good understanding of normal, and this was especially important when we did child exams. This is basically provides you with an outline of the components of a forensic evaluation, right from consent to interpreting the findings of an evaluation. This is a physical evidence recovery kit. It used to be that we collected them within 72 hours, but recent legislation has changed it to 120 hours. So we instructed our patients, if they contacted law enforcement, we encouraged law enforcement to let people know not to shower or change clothing. If there's been an oral assault, not to eat or drink. Again, we had to This is an ultraviolet light or Woods lamp. I always found it to be a pretty useless piece of equipment because just about everything will fluoresce under UV light. So this was a tool we did not use very often. This is an example of an old colposcope that we used to take photographs. And the colposcope, like Titanium blue dye, enables us to identify small injuries, and it helped us to confirm the presence or absence of trauma. So the magnification was excellent, and we were able to take photographs with the piece of equipment we utilized here. This is toluidine blue dye. It's a dye that adheres to nucleated cells. We use this dye to highlight areas of trauma primarily on the genitalia, and it enabled us to take photographs that showed very small injuries which may or may not have been significant to the case. It does not affect DNA testing, it's not painful for patients, and it really improves the quality of your documentation. And we'll work with this or have some demonstrations of this. Another technique utilized by forensic nurses is photographing, measuring, collecting basically bite mark evidence, which can be a very, very powerful type of evidence. In fact, Ted Bundy, famous serial killer, was convicted because of the power of bite mark evidence, and it was, his bite mark was on a lot of his victims. We will be talking a lot this semester about the different types of packaging for evidence collection. And remember, law enforcement provides us with all of these kits, some little and some big, some in jars, some in bags, and all of them carry chain of custody documentation with good instructions. So formulating impressions in forensic nursing can be very challenging. We had to make sure that we didn't have knee-jerk reactions and base our impressions on the facts, on the evidence collected, on the history provided to us by the patients, on experience, and of course on the research. And we had, again, always ask ourselves, what is it here that I'm looking at that makes me concerned, and where do I go to find the research or the evidence to confirm my impressions. I encourage you all to go to this website, the one that the big red arrow is pointing to, and that will give you some information about violence from a public health perspective. I appreciate you taking the time to listen to this video. I know it was like watching paint dry. Look forward to working with you all.